in many sub-Saharan countries, the organization of ministries of health are relatively similar. You have dispensaries / health clinics that are the first point of entry into the health system that serve rural to ultra-rural populations. And then what happens is that if patients need more, they get referred to a district or general level hospital and thence on to a regional level hospital. And the regional level hospital is responsible for the larger unit where you're sort of ensuring supply chain of medications and medical goods to the periphery. You're ensuring appropriate training of healthcare workers. You are the referral partner for patients who need a higher level of care, et cetera. Well, in the Lake Tanganyika Basin, that system totally breaks down because the dispensaries and the health centers that dot Lake Tanganyika and on the plateaus around Lake Tanganyika cannot reach the general or regional level facilities. They're literally too far away. Our method really is to use the lake as the highway. There is no highway, there are no roads, and there are no phones. So the access point to these communities is over the water. So what we do is sort of play the role of the regional hospital by bringing the regional hospital actually to the region. And so we interact with the dispensaries and the health centers to help them carry out their mission of primary prevention and primary care, and are sort of working towards a position where we can be the referral partner for patients who need a higher level of care. And so what we do now is a mixture of sort of facilities improvements, whether that's something like solar lighting or putting in a communications system because there's no cell phone coverage. We've currently developed a very interesting electronic medical record that works on a very novel hardware system taking into account these severe bandwidth restrictions and that kind of thing. The hospital ship itself is intended to kind of be that organizing principle, if you will, in the basin, that if you establish an actual communications and supply chain between all of these areas. Supply chain means something broader than just, do you have the right medicines? Do you have the right IV tubing? Things like that. It also means, do you have the right training? Do you have the right, refresher going on? Are you doing professional education and advancement amongst, local healthcare workers? So the idea of the regional hospital on a ship is the organizing principle around which this idea of upward trajectory and improvement, wraps itself around, that concept, because it's there and able to engage in all of these activities and ensure supply chains and communications in a way that, there is no other system that can do that right now.